so much, everyone, for joining today, and welcome to the Leong Centre Trainee Hub. My name is Priscilla Medeiros. I'm the Knowledge Mobilization and Community Engagement Specialist at the Edwin S.H. Leong Centre for Healthy Children. I'm so excited today to be introducing our speakers for this session. We are joined by Lynda Moore, who's a parent partner at CanChild Centre for Childhood Disability Research at McMaster University, for F-Words for Childhood Development and Family Engagement Research. Her focus is on engagement through personal story with sensitivity, protection, and purpose. As well, we're joined by Vanessa Tomas, who is a postdoctoral fellow at McMaster University, CanChild, as well as working with two family health organizations, Children's Treatment Network, as well as the Rehabilitation Center for Children. Now at CanChild, Vanessa works with the F-Words for Child Development team. Her postdoctoral fellowship research focuses on exploring the cultural relevance and safety of strengths-based approaches to child and family services like the F-Words and its equitable implementation. So I'm going to pass it over to our speakers now, so they can chat a little bit more about the F-Words, what that means in terms of practice, as well as in. Take it away.
Thank you so much, Priscilla, for that great introduction. And thank you so much for having us here today. We're really excited to be able to meet you and share with you a little bit about the F-Words and some of the work that we've been doing over the past several years in research in both clinical practices and scopes. And Peter Rosenbaum was supposed to be joining us today, but unfortunately sent his regrets. So we will do his part justice, hopefully. The slides that we're sharing today have really been collaborative efforts with our team over the past several years, and just a compilation of all the hard work that everyone has done and put into this. I also want to preface, I have a cough that I feel like a lot of people have that can't seem to shake. So if I start coughing and then can no longer speak, please just bear with me for a few minutes and we'll continue on. Okay. So getting started, so thanks again, Priscilla, for that introduction. So again, my name is Vanessa, and I am a white Euro-descendant settler with Portuguese ancestry, where my parents immigrated to Canada when they were about in their teenage years. So recognizing there's probably people coming from lots of different places and spaces. And so we invite you to add your land acknowledgement in the chat if you're comfortable or have a moment. But I'm going to share the land acknowledgement for McMaster University, which is located in the lands now known as Hamilton, Ontario, and is the traditional territories of the Mississauga and Haudenosaunee nations, protected under the Dish with One Spoon Wampum Agreement. This land is still home to many Indigenous peoples, and we're very grateful to be able to work, learn, grow on this land. Also sharing this acknowledgement from the perspective of where the F-Words came from. And the F-Words came from two researchers at McMaster University. So one thing to also recognize is that the F-Words did not have any Indigenous involvement in terms of their development or the worldviews that shaped the concepts and how they're being used. So recognizing some of the limitations of that as well. And I encourage us all as trainees or researchers here, or wherever space you're coming from, to think about the impact, the detrimental impact that colonialism still has on our day-to-day lives, and as in our clinical or research work that we do, and how we can, better work towards decolonizing research, constantly evaluating and reflecting on your own biases and assumptions. And this is something that we are doing consistently, even with work related to the F-Words, which we'll briefly share a little bit towards the end. So welcome to our F-Words session. I'm actually just going to move your videos up here so I can see the text on the screen. So today's focus is all about adopting a holistic, strength-based, family-centered approach to life, research, and services. So today we're going to introduce and describe the F-Words for Child Development framework and the impact for families, share some practical tools and examples of how the F-Words can be used in research, Reflect on and discuss the possibilities of how the F words may be used in your own child and family research work or wherever you're coming from. We also want today to be interactive. So feel free to, raise your hand, put questions in the chat. We'll have some structured discussion at the end. But if you do have any questions, we have a smaller group here today. So please feel free to jump in. So just so that we can know who's in the room a little bit better, we're just asking if you could change your name. Well, most of you have your name already and your Zoom username, but just adding in your role. So for example, you're a master's student. I probably should have done this with my own name as an example, but if you're a master's student, PhD student, you're a clinical student, maybe you're a research assistant, whatever your role is, and the organization or institution that you're most closely affiliated with. So if everybody could do that, that would be excellent. And then we're going to queue up. We have 2 polls for you where we just want to get a better understanding. If you're thinking about before today's session and maybe any Googling or sleuthing that you did after going, what the heck is the F words? Had you heard of the F words for child development before today's session? So we'll Oh, okay. Interesting. Okay, so most actually know, which is very exciting. I feel like that doesn't happen often, eh, Lynda?
Yeah, that's not, well, I probably was at one point, but a lot of what
Yeah,
we're doing lately is people who are partly knowing.
yeah,
So it's exciting.
exactly. Interesting. Well, thank you then for joining and being curious with us today. And can everybody see the results there? Yeah, perfect. So question 2. So if you've never heard of it before, I can kind of guess where this one's going. But if you've used it in your research before. Oh, and we have one person that has, which I'd love to hear more about. All right. Okay, thanks, Priscilla. We can share once more. Okay. Thanks, everybody. Okay. So some of you may or may not be familiar with CanChild, so which is where Lynda and I are both coming from. So I can share a quick high-level overview of what CanChild is. It's a research and education center located within McMaster University and affiliated with the Departments of Pediatrics and School of Rehabilitation Sciences. And really, we do different research and education activities that really aim to support families and improve the lives of children and youth with developmental differences and their families to be able to grow, thrive, and participate at home, school, community, work, throughout the lifespan. And we really have such a multidisciplinary and integrated team of researchers, clinicians, physicians, scientists, families, youth, service providers, healthcare leaders. So it really is a really cool and collaborative space, which generates such applicable and meaningful research. So let's get into some of the content. So this is usually the section that Peter does so beautifully, so I will try my best. So we're really going to focus on and just first start with, how have our ideas about health changed and our thinking nowadays and what kind of led to the F words and how we, conceptualize this way of thinking. So in training, both research and clinical, we were often taught to believe we need a medical understanding of problems. So that real biomedical approach or focus on disability or particular health conditions. Treatment should aim to fix quote unquote medical problems. That quote unquote normal function is the treatment goal, and that service providers are the experts. So there was typically very little family involvement And service providers are seen to, know everything, and that, what they say goes, which again is still very important. Another important thing to note on this slide is around the treatment and normal function aspect. For some medical conditions, there are particular treatment approaches, interventions, medications that absolutely can alleviate or diminish a particular issue that that person is having. But when we think of the field of disability, neurodevelopmental disabilities, if there's people here who work with adults, neurodegenerative different conditions, right? What is normal function in general? But that is not something that is attainable or achievable, and you are not able to fix, again, whatever that means in the traditional sense. But you cannot, fix or take away or cure or change those particular conditions. And so how we think about that is really important, because this previous approach could be quite harmful for the individual, their treatment approaches, and service delivery in general. So in the past, we believed experts diagnose, they treat, and they fix, and that is it. And since then, we've had quite a revolutionary change in terms of how we think about health, how we think about functioning, how we think about disability. And one important piece is now that health is not just the absence of disease, right? And this is a beautiful definition that we like to use, that health is the ability to adapt and self-manage in the face of social, physical, and emotional challenges. So you can see here that more biopsychosocial approach when we're looking at health versus the pure biomedical model in that previous description on the other slide. So really, we're focusing on functioning, however it is done, regardless of ability or disability. And that can be understood as the evidence of health. So that functioning for that person, what's meaningful for them, how they get to participate, considering all the contextual factors. And that is the evidence of health versus that sole focus on a particular health condition or disease or ailment or whatever it may be. So our frameworks about health have kind of followed a similar trajectory. So if we think about in the past, the World Health Organization's framework in the 1980s, the International Classification of Impairments, Disabilities, and Handicaps. So you can really see this linear trajectory that disease would lead to impairment, led to disability, inevitably leads to handicapped. And that is quite problematic. As you can see, it's very centered on the person having a particular condition or disease, and that very linear thinking and trajectory of what that it ends up or inevitably leads to. And of course, there's a lot of pushback on this, in particular from the disability communities. And so in 2001, the World Health Organization released the International Classification of Functioning, Disability, and Health, or the ICF framework. So some of you on the call might be familiar with that. And that framework is actually what the F words are grounded upon. So we'll talk more about that. So again, I'm not sure how many of you are familiar with the ICF, but I'll provide a high-level overview. So again, you can see how this is very different from the 1980s model. And so we're not saying that the health condition is not important to consider, because of course it is. But in the past, we typically focused on this or at the body functions and structures level. But what the ICF brings to life so beautifully is the importance of other aspects. So we think about functioning, so activity, participation, so activities, execution of a task or action, participation in meaningful events, whether that's leisure, recreation, school, work, and then the contextual factors that the ICF brings forward, which is so important when we think about functioning. So environmental factors. So those physical factors, right? We think of buildings and structures, climate, but we can also think of environments such as attitudinal, social, political, and how those things can also influence a person's ability to participate and function in day-to-day life and society. Personal factors, things that make us make you you and make me me. So my particular identities, the factors that influence who I am, what I like to do. And this is when we can start to think about that intersectionality piece too. And so all of these components are so important when we think about health, when we think about functioning. A nice thing to note here too is all these arrows, the bidirectionality of them, right? So everything is connected. So in the past, where we focus more on body functions and structures, if we have an intervention or therapy that maybe focuses on the environment, maybe this will increase participation, which in turn leads to improvements at the body function and structures level. Or when we, take a closer look at some things that might be barriers related to a person's personal factors related to engagement in therapy, or maybe things that can be leveraged that they like to do that can enhance participation. So what we like about the ICF, it's a framework for health for everybody. All of these things are important to everyone, regardless if you have a particular diagnosis, a health condition, truly for everybody. The words are neutral, so we're not seeing words like handicap or, like things that were seen in the 1980s version. And we also, within each domain, you can talk about things that are going well, so some strengths, and you can also talk about needs or limitations or weaknesses that, maybe need to be addressed as well. Everything is connected, which I mentioned. Similar, the strengths reminds us to look at and focus on what people can do. And can inform how we explore and understand health and functioning in research and practice, right? Really shifts our thinking to think about other aspects beyond just the diagnostics or the health condition and that body structure and function level. Okay, so now we're going to get into the F words. So, like I said, the F words are a way to operationalize and animate the ideas from the ICF and really provide a family friendly way to think about these concepts, because even the ICF title in general, I feel like loses a lot of people. It's got some jargon embedded in there. And so how can we make these ideas, because we know they're so important, applicable for everybody? So the F words really started, or did start, not really started, from two researchers at McMaster and CanChild, who you may have heard of, doctors Peter Rosenbaum and Jan Willem Horder. And they published a paper about the F words, again, just kind of a silly way to operationalize the ideas. And they had no idea that it would have such a profound and remarkable impact and uptake at a global scale. So as you can see, and I don't believe these stats are actually updated for several months, but the paper has been downloaded over 60,000 times, over 630 citations. Our team has been invited to present several times, locally, nationally, and internationally, about the F words. We have collaborations at an international level, which has led to so many creative adaptations of the framework. And I think that's a really beautiful part of the framework, is how flexible it is. And so we'll be able to share some of those examples with you today. So here's a nice graphic that really shows how the F words map onto the ICF concepts. So you can see the ICF concepts here, or domains here, and then the F words right above. And so we can see fitness, for example, talks about ways that we need to stay both physically, but also mentally and emotionally fit and well. So considering both that physical and mental well-being. Functioning, again, it doesn't matter how you do things, it's that you get to do them in a way that's meaningful for you. And so that's a really big part of when we think about functioning. Friends, relationships with others, and that can be same-aged peers, can be family, it could be pets. There's many different friendships that we have in our lives. Family. So we know that for children in particular, this is the most important environmental factor in their lives, and that families should and need to be involved in care, in services, in research, and how we look at and approach services with these children and youth, because family knows the child best and they are the experts in their child's lives. And even when we think about family, right, this could extend beyond immediate family or can extend to community, right? And who we think about that circle of support is for that person. And fun, of course, this is an easy one to talk about. Life should be about having fun. Everybody has interests, things that bring them joy. And how can we think about that and incorporate that into our own services and work? And then, of course, future is important for everybody. And whether that's tomorrow, a week from now, 5 years from now, thinking about that future piece, and important to acknowledge that, these children and youth and whoever it may be have a future, and important to talk about that, acknowledge that, and discuss that in ways that are meaningful for that family. So as the F words were first released back in 2012, our understanding of them or the words themselves, how they're defined, the framework have really evolved. And I think, the authors do such a great job of being so open with conversations with families, with service providers. Like Peter, for example, is always like, okay, it's great to hear what you like about it, but tell me what you don't like, or what's not going well, or what have you struggled with? And that's where we learn, and that's how we can improve and enhance the framework and how it's used. So I'll highlight just a couple of examples. You probably noticed in the original paper, it was called F words for childhood disability, and recognizing that it's not just for children and youth who have a diagnosed disability or, a developmental difference, but it really is for all children, all youth, adults too. These words are applicable to all of us. And so the title has changed to F words for child development. We also recognize F words doesn't sit right with everybody, and the connotation is not appropriate for everybody. And so some organizations that we work with, so for example, one in Manitoba, they instead use our favorite words. Also, in the translations that we've had of the F words in over 35 languages, I will add, they don't always translate to a word starting with the letter F. And so you can't always call them the F words. And so in those instances, they also use our favorite words. In terms of the definitions, I'll maybe highlight the friends one. So this one we used to talk about as making friendships with same-aged peers, which we recognize those social relationships are very important. But for some kiddos, this is a bit more challenging and can sometimes make parents or make that child in particular feel less or feel defeated if you're having conversations about friends grounded in that way, and they feel like they're not, maybe at the same level as some of their peers. And so acknowledging that friends can be anybody, friends could be family, friends could be pets, friends could be, people who maybe are a couple years older, younger. And, as long as that relationship is meaningful and fulfilling for that person, that's what matters. And so how we talk about friends as well, too. And then interestingly, too, with one of our Indigenous partners, they actually talk about it as friendships. They talk about the quality, that reciprocity of the relationship versus like, these are my friends. So there's many ways that you can think about these ideas and these words. And then fitness, we used to just have the physical, but we added in the mental and emotional because that's an incredibly important part. So I'll just high level of some of the changes and adaptations. So it's important to note that the F words is not a new assessment measure, does not diminish the role of therapists or physicians or professionals, and also doesn't diminish the role of therapies and interventions. These are still very, very important. But what it does do, it increases the role of children, families, and their voices in services, emphasizes family values and goals, sees the child in the context of the family and their environment, and can change the dynamic of families and professionals. So we've heard from people that it's such a great way to build, rapport, connections, build that trust between the provider and the family member. So now I'm going to get into some F words tools quickly. So all the things we're talking about, and if you're interested in diving in a bit deeper, the F Words Knowledge Hub is the one-stop shop for everything F Words. So we have all the tools, translation examples, how organizations are using them, trainings, videos, all available on the F Words Knowledge Hub. So we have the QR code there. You could also Google it, or the hyperlink is pretty short and sweet as well. So the first F Words resource was a poster that was created in partnership with World Cerebral Palsy Day by the Cerebral Palsy Alliance in Australia. And this poster, people have it in their offices. We have them up at CanChild, but people have them up in their like weight rooms, their, clinic offices. People have like massive, human-sized posters that they have within their organizations that are so interesting and so cool to see, to really just spark that curiosity and like, what is that? And have that conversation and increase that knowledge and awareness. And it's been translated into over 35 languages by colleagues around the world. And you can see some examples here. So we have one example of the framework translated into Urdu and many, many other languages. Our colleagues in India also did a translation of the images to make the images more appropriate for, their families, their communities that they work with. And so these are just a couple examples. We have, or most of our tools, I would say, have been co-created or created solely by parent partners. And these are some tools that are really great at sharing an F Words story. So we have our collage, so sharing your F Word story through images, the profile, writing it out or sharing it through words. An agreement, which is similar, again, sharing through words, but can provide that introduction or introductory document of that child or that person to whoever it is that's working with them, whether that's a service provider, whether that's an educator, whether that's a researcher. Great way just to start that conversation and have that person learn more about the child and the person beyond their diagnosis or the reason that brought them in, right? And then one of our parent partners also developed an advocacy guide for school, which is really, really neat as a way to kind of guide IEP meetings or guide transition to school conversations, whether that's, entry to school, high school, leaving school, all of those different milestone moments. We also have a goal sheet. So this was developed in partnership with some physiotherapists and have since been adapted, where we have the goal related to the F word, but the really neat part is the why, and gets to, why is that goal important? Is that goal actually important to the family, or did the therapist decide that it was important? And so how we can work that into the conversation too. And you don't always need a goal related to every F word. One goal could, relate to multiple F words. But I think the point is to have that more holistic goal setting process grounded in the family's goals and values. You can also do it in very creative ways. This is an example of an individual and their family who had their F words goals. And then once the F words goal was achieved, or they felt it was achieved, they took a photo to be able to showcase that. So we have beautiful, different creative examples of how the F words are being applied. This is our favorite. It's a drawing by a 7-year-old sharing her F word story. And so again, you can see that it can even come from the child's voice themselves, and a great way for them to be able to participate in their service delivery, right? Or service goal setting, whatever it may be. So I won't go over all of them, but I just want to highlight this one because it's the best part. The future. So this 7-year-old put her future goal is to be on a boat in the ocean, being a mom with a baby in her belly, and holding a sunshine balloon. Is so sweet. So it's such a great way to be able to get that involvement and that engagement in a way that's meaningful for everybody there. Our colleagues in New Zealand and Australia combined the F words with solution-focused coaching to create the F words life wheel. And so this is also a way to really get the family involved, and they can actually provide a score or a rating for each F word and then monitor that, or they can provide a basis for check-in. So I'll just show you on the next slide. You can see an example how a particular family rated this, what some of the context of that was. And that way you can identify, what's going really well and maybe what needs a little bit more attention and why. And so it's, again, a really great way to get the individual and the family involved. More recently, for anyone who's in the mental health field, we've developed in partnership with the Ponda Network a collection of guiding questions to support development of emotional well-being. And so there, you can get this, again, all on the Knowledge Hub under the tools. There's a whole guide under each F word. There are particular questions to help guide conversations more related to mental and emotional well-being and health. Okay. So now we're going to get into our F words research and knowledge translation program. So I know many of you here, and I'm just going to do a quick scroll actually because I haven't yet with the names. Most people here are researchers. So we're going to share a little bit about our research program, and then hopefully have some time. And I think looking at the time, we'll have some good time to be able to discuss how the F words might, or if or how they might apply in the research work that you're doing, or some of the approaches that we've taken in our research program and how that might be translated into what you're doing as well. Okay, so our research and knowledge translation program. So back in 2011, 2012, the original F words paper was published. So this is what we typically call diffusion. So kind of those passive strategies. And it was published, and I think the uptake was, again, a lot more than had initially anticipated by the original authors and the team in general. And really what that sparked was seeing the interest and the potential in these ideas and the impact that that could have for families, providers, researchers, etc. And so around 2014 is really when the establishment of the Research and KT program, or Knowledge Translation Program, developed. And this is when our F words integrated research team really formed. And this is when we began thinking a little bit more about dissemination. So those of you who aren't familiar with dissemination, this is really about how can we change knowledge and awareness? So how can we get these F words ideas out there? And this is when we started doing things like, creating some of those resources that you saw, specific tools, doing educational outreaches and workshops and presentations, and creating the Knowledge Hub to be able to share these ideas. So some of those more active, intentional strategies. And then more recently, our focus has really been on implementation. And so this is changing behavior. So how can we get people to actually use these ideas? How can they use or implement the F words in their practice from that provider, from that family, from that organizational perspective? So we've really been focusing on implementation, although I feel like dissemination is always integrated throughout, the different initiatives that we do. And so through this, we really had and developed such a beautiful and big team that I feel like or small but mighty, actually, I shouldn't say big. But we have such a great team of individuals really leading this work. And it's really a collaborative effort, both within CanChild and our family partners and youth partners and service provider partners. But we have also so many collaborators from across Canada and also internationally. So here's some pictures of our team, and not everybody is on the slide here, but we have really, and I think, again, so powerful. What makes our team so powerful is that real integration of families, service providers, healthcare leaders, trainees, researchers, clinicians, all doing both the research, the dissemination, the implementation, all of this all together. And so for those researchers in the room familiar with this term, we really take an integrated knowledge translation approach. So we're really doing things in collaboration, equal partnership for all of our F words projects. So here's a picture of a couple of us at the Empowered Kids Ontario conference last spring, where we did a presentation about our F words implementation initiatives. This was at the recent Kids Brain Health Network conference in the fall. And here you can see little Owen, Lynda, some other members of our team, Rachel, Kim, there's Linda's husband in the background, Jesse. So when we were in BC, and we're going back there again in April, and actually leading some F-Words implementation training and consultation with some organizations. So we're really doing all of this work together to make it more meaningful, right? And for those that it's intended to be used by, impacted, and so really doing that in partnership. So here are some examples of studies, and again, all done in partnership with families, with service providers, including, writing the manuscripts, sharing the findings, really that dissemination piece. So just to show kind of an evolution of some of our studies. So this is when the Knowledge Hub was first published. A survey, just understanding how service providers are using the F-Words, exploring 10 years of how we've disseminated the F-Words to really make that shift and increase knowledge and awareness at a global scale. And this is actually a recent one from our colleagues in New Zealand about the F-Words life wheel and families' perspectives and service provider perspectives on the impact that the life wheel has and has changed their service delivery approaches, how it's received, the impact, and also some connection with Maori health models. So this is a very interesting paper if anybody is interested, and I believe most of these, if not all, are open access. So our two current studies that we're doing now, again, are mainly focused on those KT, so dissemination, but mainly implementation. So first is our organizational implementation study. And then second, we have development, implementation, and evaluation of our F-Words Foundations program or course. And so I'll get into them very, very high level. So our implementation study kicked off in 2020, where we received a CIHR planning grant to bring together organizational partners. So we have 3 in Ontario, 1 in Manitoba, and 1 in New Zealand to really talk about, what should we do? What's going to be helpful for you guys, and how can we, make this the most impactful? And so that led to a study that was going to be predominantly focused on what's the impact of the F-Words to we actually need to study how this can be implemented or how this can be used in practice. And so we really shifted our research direction through working in partnership. And since then, this study has been done in full partnership. So much beautiful outputs, connections, findings have come from this that I can't wait to share with everybody. We can't wait to share with everybody one day soon when we finally have the time to write it up. But we had two main research questions that we were addressing. So first was, like I said, how can we, really explore and understand the implementation strategies used to support adoption of the F-Words? And what are the factors, so those barriers and facilitators that influence implementation at the organizational level? And then, of course, through that, we also wanted to understand the impact of the F-Words on parents and caregivers, service providers, and really understanding, is this, how is this making a difference? Anecdotally, we know that it is, but having some more of that qualitative evidence from families and from service providers to really ground our work. And a funny thing about this too is, so again, part of that planning grant, we were going to, the purpose of doing it was to, again, design the study together and then submit eventually a CIHR project grant. But all of these organizations were already so excited and really wanted to implement the F-Words, or already kind of were in some capacity. And they were like, no, we don't have time to wait for another grant, or if we don't even get it, let's just do it. And so they all did this in kind through their organizations. And I think really speaks to the impact and potential that these ideas have and can have. And so the study was really unfunded and in kind through these organizations' time and commitment. So I'm not going to get into all the findings, but I just wanted to share a couple highlights. So for F-Words implementation, for those of you who are familiar with implementation science on the call, we mapped the strategies to the ERIC compilation, or the expert recommendations for implementing change strategies, to understand, what kind of strategies are being used, how or if do these map on to these, evidence-based strategies. So things like educational materials, organizations were creating particularly newsletters or handouts for families. Changing records and forms, people embedded the F words into their record system, into specific forms and documents to guide services. And then, oops, sorry about that. Changing physical structure equipment. So this organization in Manitoba actually had it on a screen in all their client waiting rooms, and they have it big poster outside of each waiting room for with family profiles, staff F words profiles. So just different ways to get it out there and to be more visible. F words impact. So again, not going to get into do the research findings, but some of the highlights are some examples of quotes that were shared from providers and families. So here you can see a service provider moves away from an expert model and engages the individual and their family in decision making. I like the emphasis on all aspects of an individual's and family's life. The service provider said, I love that it reminds me to talk about what is important to the family. It leads to really rich discussions about the child and their goals. And then I think you heard the impact from a family perspective so beautifully from Lynda. And then we have some other parent quotes here. I like how positive they are and that they consider what is important to our family as a whole. And then the F words seem to be just what we need for our children with disabilities. So again, this project was done in partnership, right from designing the research question all the way to dissemination. So now we're co-presenting some of the findings to the organizational partners right now. We've co-presented at conferences, everything really, really done in partnership. We met monthly. Through this, we've created a community of practice. We created implementation support resources for the organizations. The organizations led recruitment. They had their on-site implementation teams, and they were the ones leading implementation. Right now, we're finishing up some data analysis, and they've been part of the process to provide feedback and initial thoughts. So really done together in partnership the entire time, which I know this study would not have been what it was if it wasn't for that, because we learned so much from them along the way, and it really helped to shape, okay, we got to amend this, we got to change this, how can we make this better? And so we really worked together to be able to accomplish that. So the next project, or our main F words project right now, is our online training program. And so we have we receive a lot of requests for F words training, far beyond what our team could achieve with just a small number of us. And so as funded, which is really exciting, funded by the Ontario Ministry of Children, Community and Social Services, we were able to develop an F words online training program. And so through that, we are now evaluating the training program through a Kids Brain Health Network funded project, where we first evaluated the usability, acceptability, and feasibility of the course. And now it's being rolled out and implemented in different organizations. And we're comparing the self-paced version, so doing it on your own or individually or as a group at your own time, with a version that also has facilitated discussion or conversation after each module. So we're looking at how this can be implemented and also which version of the course might be more supportive to not only increase the knowledge and awareness, but potentially also use of the F words. And so for those who are interested, it is free to enroll, and you can do it at your own time, own pace. There's a QR code here. Hyperlink is also there. If you go to the Knowledge Hub, you can also find it. Please feel free to email us afterwards, or we can put it in the chat maybe afterwards. And if people are interested in learning more or would like to take the F words online training program, because today we're just very high level snapshot of these ideas. And I think the best part of the course and the program is hearing all the family stories, all the service provider examples and stories of how these ideas can be implemented into practice. So now I'm going to pass it back to Lynda, who's going to share a little bit about her experiences as being a parent partner on these projects.
Yeah, thank you, Vanessa. So I'm a mom of an almost 6-year-old who I can hear yelling right now because he wants more video games, and I think that's what Dad's letting him do while I'm talking to you today. And prior to having my son, as you may have caught from our story, we lived on a rural property. We grew garlic and sold it at markets. I'm a writer and film studies by my university training. Not a researcher, not science, and I was not a public speaker. Hide behind my poetry. So when we learned the F words, I kept emailing members of CanChild, looking for, faster, more support in our local area, because I had no understanding of how these things actually happen and take place. I do know that in the NICU, there was a suggested choice for our son by the nurse staff, and we went with what we felt was the better option. But then I call them the higher ups, drew a line and said, this information's anecdotal and we're going to stick with our current protocols. We could shift them, but we're not going to because there's been no studies. And someone asked me, would you sign your child up for a study at this time while he's, in a little isolate, hooked up to machines, fighting for his life? And I think back of that moment constantly, that there was a belief to make a change, but no research to back it up. And the assumption that no families would want to participate in the research with their child. And when I met CanChild, it was through sort of bothering them about how to get more F words implemented, and then getting kind of fast-tracked through the FER program, where I learned more about the research process and the role of lived experience as a family or community partner. And it was extremely eye-opening. I'll say I joined during the creation of the module training that Vanessa was talking about. And I think I'm maybe my 3rd generation or 2nd generation parent partner. I don't even know. I get to learn from the family partners that, in my mind, really paved the way for how our voices are seen and heard. My roles that I like to take on are protecting the language use for the participants, which are often the family members in these projects, thinking about how they would receive the information, how comfortable they would be giving their information out and why they're giving that information out. And having this, like it says, co-leading the delivery, having this co-leading environment where we're working with clinicians and with researchers and everyone having an equal voice, I feel like you can see the live shifting of the project, never with a particular end goal that's hard fast, always with an open mind of where does it really need to go? Where is the research actually taking us? And always sort of thinking what's next with our team, which is incredibly inspiring as a parent to a little one who's using this, using these in his real daily applications. I can hear him yelling. He's really upset about this video game getting turned on. And I say, I am a parent first and foremost.
Oh,
I
just
hope
this
you can't
picture
hear
of him
him
is
because
so
he looks
cute.
so nice and polite and sweet in the photos.
I can't hear him.
Okay, good.
And then Lynda, you're also now she's being too humble. She's
Yes.
now also the F words and family engagement outreach director at CanChild. And so like it's been so wonderful to see like your growth too, and how like confident you've become in your role, and now all the amazing work she does, and she leads through doing workshops like this. She leads our social media, like all of the tapping into all of your strengths and creative skills, and how much you do contribute to the team now as well, and throughout all of these projects.
Well, I think we see a lot of our family partners, we come with a background anyways. Maybe this wasn't the path that we were going to go on to, and then life sort of shifted us. And you can see the passion behind being a parent partner, that you may not be able to make a change for your family in particular, um, just because of the timing of things with research, but you want what you're experiencing to hold value, in the real world, and to be accepted on a team, and to have the skills that you bring anyways combined with your life experience actually valued and heard is, very meaningful, to our hearts as parents. But you can see the different directions the other parent partners, here at CanChild are pulling the projects with their own personal expertise, which is different than mine. I'm just me. I'm just Owen's mom with my background, and we have other parent partners with their backgrounds, their lived experience, which helps to, I think of it more as just opening the perspectives as opposed to closing them.
Yeah, absolutely.
Yeah.
All right. Well, thank
Very
you, Lynda.
Thank you.
Thank you. All right. So this gives us some good time if we want. So maybe we can do breakout rooms. Priscilla, um, if we could get even just like 2 breakout rooms, and we always contemplate whether we should go in them or not. So I think we'll let people talk and then we'll come back and discuss. But we really want people to think about reflecting on your own research. Do you see applicability of the F words in your research or the clinical work you do? Why and how, if yes? And what might be the strengths of using the F words in your research or clinical work? Or are there any challenges that you foresee? And just in general, having a conversation about, what we discussed and any aha moments, any learnings you'd like to share. And we can do this in breakout rooms, maybe give everybody 10 minutes, come back, open it up, and then we can close us off with some questions in our final slides.
Vanessa, I was wondering if you could actually take the lead in creating the breakout rooms.
Yeah, no problem. Okay, let's see. Oh, I see a couple people have trickled off. That sometimes happens with breakout rooms, right?
Do we want to stay in the same room?
Yeah, why don't we just stay here then? Okay, so I'm going to stop sharing, and then we can go from there. Okay, sharing where you can see everybody. Maybe I shouldn't have said the breakout room word.
Yeah, a lot of people said thank you and then left.
Yeah, they're like, oh, breakout rooms, no,
It's
no,
not
no.
an actual test.
So funny. Okay. I'm gonna, oops, why does it look like that? Okay, all right, so maybe we could open it up. If anybody would like to share any learnings, any aha moments, any ways that you foresee potential applicability of the F words, anything in our approach to our research that maybe stood out to you that you'd like to share.
I'm thinking about my own work, to be honest, and how often the F words themselves never actually come up in conversation with patient, family partners, or community members. Often it's very clinical. They keep it very much to the language that they're accustomed to hearing in the clinical setting or a part of research projects instead of making it their own. And often it takes some time to build that trust before partners feel comfortable kind of integrating their own experiences, their own stories for you to start picking up on how they're approaching their care or their families are approaching. So this has actually given me some inspiration within my own work to think differently of how to pose questions and how to frame certain elements
That's
back
awesome.
to them to start, building more of that trust, inviting in their ways of talking about this in a more accessible way.
Thank you so much, Priscilla. That's awesome. That's exactly a great example of how it can be incorporated.
I think about even just the definition of family. in our, we do participate in research, and as a family, we sign up for what we can. And then in our appointments, you don't, as a family, you don't want to feel like you have to overly explain why you may feel that you don't fit into a criteria that's predefined. So even just what is family to you, what is friendship to you, we don't have to explain why we're both there. We just are. It's just mom and dad are present. We're both full-time. You can speak to both of us. Yes, when you call, you can leave a message with the dad, even, that sort of thing. But then in our peer group, there's a family who always feels like they need to apologize because dad doesn't want to take part until a certain point, and it's because of his own personal reasons. They don't need to explain it. They just say, our family for these appointments that's present is mom and Nana, and you can, we're both excited to be here and to learn what you have for us. And being allowed to define who you are as a family without why, I think it's important for setting the tone of how you're going to feel for the next questions that come up, the next decisions that need to be made, because you're welcome right from the start under your own definition of self.
Exactly. Great example.
Yeah.
Martina, Andrea, Erin, Jamila, or please correct me if I mispronounce your name, anyone. But anyone have any thoughts that they'd like to share? I'm just looking at the chat too.
I wonder if I can ask one of those questions to both of you that we had kind of prepared in advance.
Sure, yeah.
Those on the call a bit of an opportunity to think critically about their own work. What are the key ingredients? I've been thinking about this throughout the presentation is, what are the key ingredients that have made this program so successful? We got tidbits of it through Lynda's perspective as a parent, bringing something so new to the QA. And I want to hear a little bit more about that element of, the success part. Like, what is it about it?
Yeah, I can go first, or Lynda, feel free to jump in, or if you want to elaborate or expand from the family perspective. Speaking as from the research side of things, honestly, I think that partnership piece has been or is critical. I think partnership with both families, but also the service providers and the organizations, because I think it's one thing from a researcher perspective, who I am not a clinician by training, so I don't have clinical background. I don't clinically practice currently. So I think having that understanding of, it's easy to say this is what, should be done in practice, or this is how families should use it. But without having that lived or living experience of that, I think it's very hard to make those generalizations or those assumptions. And I think even like I can think of numerous examples with organizations we've worked with where, one thing has worked perfect in one organization, but another organization that would never fly because of XYZ policy, or they have a smaller team, or their leadership is, not on board or less on board, or whatever it is. Or if you think of the political climates in different provinces, right? In Ontario, the F words are now endorsed by the ministry or the MCCSS and the Smart Start hubs. In the recent preschool speech and language rehab guidelines, whereas in other provinces it's not. And so the tensions of that, and I think, really working with those who are going to be using it is so essential to ensure that, you're not just publishing another paper. And I think our team, does a really good job at that, I think, which in my opinion matters more, that real life, real world impact versus, publishing another paper. And I know we still need to do that because there's lots of learnings from this. But publishing a paper is great, but what is that going to do? Or what does that actually mean in the daily lives of families or those providers who probably don't have time to read that? Or, it's not always accessible for people to read. And so how can we make things and ground our work in that, in the lived experiences of those people using it, receiving it, whatever that may be? I would say that I think is a really essential one. I think the importance also of slowing down and building relationships is one thing we particularly are learning through our work with our Indigenous partners, both in Ontario, Manitoba, and just taking the time even before talking about research or any sort of project, and taking that time to just build connection, build relationships, not pushing anything onto anyone. Sometimes, not everybody likes the F words, and that's okay. And it might not be relevant for everybody, and that's okay. But, for those that it is impactful for, how can we make that the most beneficial? Yeah, and I think from the implementation perspective, the importance of context is a big one, readiness, and thinking about, one organization is very different from another organization, just as one family is different from another family, right? And so really taking that individualized approach, which you can do when you do the work in partnership. And that's how you get to those deeper understandings. It does take longer, but I think, or not always, but usually when you're taking the time to really build this out together, it can take a bit longer. And so, but I think that's where you're going to have the longer term impact.
I agree. You raised so many important points, Vanessa. Like, I was trying to keep track of each of them, so I'm glad we're recording this session. One important thing that resonated with me, and perhaps with the trainees who are on this call or will be viewing this after the fact, is that there's so much pressure to, publish or perish, but I also think there's so much importance around publishing for the academic audience to get to know what's involved in these processes. What are the lessons learned? How can we be improving so that we can be learning from one another? Often these sorts of conversations are not being captured in core academic publications, or very quickly in the limitations section of a publication, rather than spending the time unpacking them from the perspective of not just the research team, but the patient family partners, the community members who are involved, capturing their reflections, their processes, and then of course evaluation, what that entails. What does that mean? How does that feed into implementing this and making it a success so that it can spread and scale? And you're right, one size does not fit all. So there needs to be this co-creation, this collaboration that takes place, which is what Lynda talked about, in order for it to work in different settings so that it resonates with everyone, regardless of their background, regardless of language, where they're living, if it's urban, hinterlands, or rural regions. Taking that all into consideration is important, a part of this equation of equaling success. Lynda, I'd love to hear your perspective.
Well, there's a lot of changes and shifts and adaptations to the F words, but you can see that the core concepts of being overlaid over the ICF, which is a really important grounding point, that doesn't shift. So you're not going to lose what I'll call it the actual messaging is. You'll just lose the delivery. You'll not lose. You'll gain new delivery modes for it, depending on what is preferred or useful for the individuals or for the organizations. I know I got the luxury of seeing it get implemented here. I always say spying in the background. I wasn't. You could see my face on the screen. But I got to see from people that I'd already worked with how they felt as service providers being told about something new. And I think about I'm going to just bounce off F words here. It's my life now. Gladly. When you think about the goal setting sheet, it's the why that is valuable. And when an organization is wanting to implement the F words, knowing why are they implementing it is important so that we can help with the right starting point? Is it coming to them because they've asked for it or because someone above them told them they're doing it? And what do they already have in place so that the adaptations can fit more seamlessly as they transition, which obviously shifting how you do your day-to-day job can also be a lot for a person. So having that respected that this is a shift for those people. So the team is going to hear you out and offer a variety of solutions for you, but still grounded on that main concept. So in my mind, I think of, when we as a parent say we want our son to be able to, like, we might ask that we want him to have a gait trainer that can go over roots and rocks and mud. Well, why? Is it because you really want him to use a gait trainer specifically, or because you're trying to get him outside and you only know about a gait trainer right now? So the actual goal is to get him out on hiking trails. Turns out there's a lot of other options that I didn't know. So I think of it that way. The goal is to implement more of a friendly version of the ICF and shift their model that way. It's not to use in particular maybe one tool that they saw on the website. So it's sort of ever expanding, but always with that anchor in what the original paper was about. And I have to acknowledge, I recently saw an amazing presentation that Dr. Rosenbaum gave where he said, when you're in your research project, are you thinking about what's next? And I think that the team, not myself, I'm the parent partner who dreams a million things that may or may not be possible, but the team who understands all the steps that need to take place and in what order. I think they're always thinking open-minded what could be next because of the feedback that they're getting from the people that they're actually creating this research to help, as opposed to their own personal goals. Maybe they're thinking about the wider audience. And I think that's part of the beauty of this project and how it's grown and changed over time. Yeah.
Yeah, Lynda, you are part of the team.
I know.
Whenever you say that, I'm like,
I know they always do that to me, but I feel very lucky to be part of this team. We wanted the efforts to help obviously our family, and then we learned just 10 minutes away they weren't being implemented for a family that we knew, and we wanted that change to take place. So I feel very lucky to be on this particular project, but then also the knowledge that I'm growing. I'll eventually say it, Vanessa, that I'm I know I'm formally on the team, but
you are. And yeah, and not just a parent partner. You always say that too. But your comment there just made me think of like, for example, so the implementation study that we did, again, in partnership with these organizations, led to honestly my postdoc project now. And like what we're doing right now is because questions started coming up about the cultural relevance, the safety, inclusivity, acknowledging the grounding of the F words in the ICF framework, which is a Western, predominantly Eurocentric framework and understanding of the world. And what world do you shape that in, especially in the Ontario context? Before using it with, when we think, and by the Ontario context, I mean thinking of that policy level and embedded in within ministry guidelines, before using with our Indigenous communities, like, is this something that's even supported? Is it meaningful? Is it safe? Is it inclusive? And so that really led to conversations like our team is awesome at like, yeah, that's a really good question, like let's talk about that more. Okay, yeah, you're right, like what can we do? And then we applied for another planning grant, and last May we all got together in Winnipeg to start exploring some of those ideas, which then led to, okay, we need to do a lot more work in this area, not only for Indigenous communities, but Canada is a very diverse country and different cultures, and thinking about intersectionality and, not just culture, but different socio-demographic factors. And maybe some families can't talk about fun, or, family might be triggering for them. And so how can we think about these ideas and this framework, especially for those organizations where it's so embedded, to do so in a safer way. So that's kind of then led to our next project. And all of these have really come from these partnerships, because that's not something we would have known, or would have, I would never presume to think something like that, because I am not Indigenous and I am not, so you can't make those assumptions without working with those individuals, and who are leading that with us. So it honestly all comes from that partnership piece, and we can't work in silos as researchers. And if you want, again, coming back to your intentions as a researcher and your goals, and if it is to make that impact, and how you can support whatever field you're in, or whatever populations you're working with or groups you're working with, to really do that in partnership.
I think that's such an important point, and something to consider. Like, I'm looking forward to, learning more about this next phase, working with Indigenous First Nations communities to see how this resonates with them, and how the language, for instance, or the ways in which it's presented needs to change in order to, better align with their lived and living experience of this, and to really acknowledge, the stories and voices of families and children from different communities across the country. This actually is a really good segue to the question that I like to end the kind of event on, around advice. We have a number of trainees that were on the call that will be watching this. So in both of your perspectives, how might trainees consider using the F words in their own research and practice, and what advice do you have for them as they're thinking about perhaps embarking on this initiative, and thinking about how to integrate this into their graduate projects, or go back to their teams and present this as a potential idea to align with their work as they're moving forward?
Oh, that's a great question. Yeah, it'd be interesting to know what fields everybody is coming from, but I presume child health and development mainly. Yeah, I think a big part, I think, is, again, like how you introduce it, and bringing it back to your team, and even sharing, some of the resources, some of the impact statements, but thinking about, what if you were to use the F words, what in particular would it be used for? So is it more around that partnership piece where you're, building relationships, connections, trust, getting to know each other on the team? Like, I think it could even be used as like a communication team building tool. It could be used in terms of, if you're thinking about more qualitative studies and you're assessing, different aspects of a person's life related to, hard to give concrete examples because I'm not sure what people are doing, but related to, a particular intervention, or a particular, condition, or a particular, whatever it is you're looking at, participation activity. You even asking questions grounded in the F words could get that more holistic picture or viewpoint of whatever it is you're assessing, or exploring, right? Even we've seen it in terms of analysis. So like analyzing intervention components, or different activities, again, through that F words lens, to be able to understand a little bit more about that intervention or that individual's experience through an F words lens. It's great to use for storytelling. So if, that's an approach to incorporate into your research, it's, so many different tools. It could be arts-based, different opportunities that might actually be easier than sitting in, I don't want to assume that for sure, and less intimidating than sitting in an interview, but allowing a family member or a child or a youth to share their story through an F words perspective, right? Could be a really unique and innovative way to incorporate that. But I think, kind of circling back to the grounding and why our program has been so impactful, is doing this in partnership. So whoever it is you're working with, or if you're not working with particular partners for whatever reason, I know as a trainee, there's so many factors and things that, influence your ability to do certain components of a project. But talking to who your partners are, bringing these ideas and being like, what do you think? Is this something that we could incorporate? How could this, relate to our question or shift our question? And seeing what they think too in terms of innovative, creative ways to be able to incorporate. But in terms of if you're like pitching it or you're like, I really want to use this, I think going to our knowledge hub and sharing these quotes, sharing the impact that this can have, like stories like Lynda's, going to the modules and looking at some of the videos, I think those speak volumes for, showing why this is such an impactful approach in practice, but also from that researcher perspective. And how can we advance our understandings of how we look at child health development and well-being, and how can we look at things through that F words lens, right? Whether that's the questions we ask or how we analyze or explore information, experiences, stories. And then of course, yeah, always in partnership when you can. And if you can't, acknowledging that limitation, but what is in your control that you can do.
I think those are great words of advice. I'm going to ask Lynda the same question. If there's anything you have to add from your perspective, your experience, and the advice you'd like to impart on the trainees.
Oh, I'm just laughing because as Vanessa's talking, it's so many, so many points you hit. It's excellent. I know our family experience is really taking ownership of the F word, so I come from a different perspective in how we use it in our lives, and I imagine that it would be helpful, as Vanessa mentioned, for an introduction, because often when we come into I'll say appointment experiences or into projects as partners or as participants, I think we feel like there's choices that we can try to fit into, as opposed to that possible unknown, which may also have value for the appointment or for the research, which comes out through the open discussion that the F words tools do allow. I can imagine just with our school inclusion suggestions that often there's a few options suggested for us and they don't really fit particularly for our son. And instead of explaining why, we can sort of introduce who he is to help the team know which avenues to then present to us. So I feel like it stops that initial barrier of quiet space where no one knows how to answer because the question's not actually appropriate for them, or it allows the individual to think, what do I have in my tool belt that I can offer these people? And I say we take ownership, we use it in every avenue. And we have a friend who is currently deciding options for cancer treatment, and they're feeling overwhelmed with the way the options were presented to them. So I will share this because I know they said it's okay. They're going through their efforts for themselves as an adult, thinking about how they want their life to look and their goals and where they have value for how they are living to help them make their decision. And it's just a way to make that more tangible. So I know, like, it's a funny thing, Vanessa, there's the formal research, there's the formal implementation into the health organizations, and then there's just the ownership of it as a way of communicating and being, I always say humans, we're all just humans. I know our physicians are humans, they're not just robots who have this expertise. They come to us with different experiences, including that day. I don't know what their morning looked like, how they got there that day. And I think this is a way to just allow everyone to sort of take a breath and see each other as endless possibilities, which then allows projects to expand or shift more organically, if that makes sense. Not sure if that's
No, it was very helpful. And it's so nice that you highlighted that there are so many different applicabilities to using this. It's not just research, like it's very much providing ownership and agency to those that you're working with to really take the reins on care and setting up what those goals may look like.
Exactly.
Looking at the time, I just want to be cognizant and also to allow the trainees that are on the call to contribute to the conversation. If there's a thought they'd like to share, potentially pose a question to you. So I'd like to use this as a little bit of a final sweep to see if there are any lingering questions out there for our speakers. And of course, they've offered to answer questions after the fact if you need some opportunity to reflect on your own work and your projects, to reach out to them directly. And I too will be following up, of course, with this recording and some additional links of their website that could benefit you in increasing your knowledge and capacity around these tools that were mentioned today. So any questions from those that are on the call, please feel free to raise your virtual hand or to insert your comment into the chat.
I can put our F words email in the chat too, so you have our emails too, Priscilla, so feel free to share those.
Absolutely. Well, if that's the case, I'd like to thank everyone for joining us today. It's always a pleasure to bring together the group and have a great conversation with the trainees around, knowledge translation, childhood research. It's wonderful. So I want to thank both of you, Vanessa and Lynda, for taking the time to come and join us today and speaking about, the possibilities of using the F words. I think it was such an illuminating conversation and great to get to learn a little bit more about yourselves, the work that you're leading or co-leading, as well as F words as a whole. And we certainly look forward to having the trainees join us at the next event next month. So have yourselves a wonderful rest of the day. Thank you.
Thank you so much for having